It's time to mind your business with me, Jamillah Lodge. Tune in to find out how to mind your business with BEDC, special guest entrepreneurs, industry experts, and more. Brought to you by BEDC. Bermuda Business starts here. Welcome to Mind Your Business.
Thank you.
So, of course, I'm Jamillah Lodge. You are Matt Francis, and owner of Atlantic Podiatry.
Yes.
But you have some other things, too.
Yeah.
So, you're partial owner of Moongate Brewing Company and co-owner of The Blind Pig. And we were just talking earlier, but how are you finding the time to do all these things?
You make the time. So I have a 2-year-old daughter, Orla. I have another one on the way in October. So, yeah. So it is a bit of a learning curve, and I'd say I think the pace is just having to slow a little bit. And, as you get older, you kind of learn that, I can't go 100% all day, every day.
All day, every day.
Which has been a really interesting transition. So for me, my hobby has been starting businesses. And that's what I do. I finish, I do my sensible day job, I go home and I sit off, and then I'm doing something else. And that's how I kind of get enjoyment. You get to a certain point in your life when you realize you don't always have to do everything on your own. And so for me, that's where some of the other businesses, so the Blind Pig Cocktail Company that Summers myself started in 2017. For that was something that we both worked in bars a lot. We both had an interest in doing something. We realized as an individual it was quite hard to do something, but if you start cooperating with other people, it made life a lot easier. And so because it was 2 of us, it's half the workload. And somewhat that's been the case with Moongate Brewing Company. So those guys opened in December of last year. There's about 6 of us that are all working together. We've got Rob Pantry and Xander Dill. They're our head brewers. They are incredible at brewing beer. I personally have no idea how to do that. So
you just get to benefit, right?
Exactly. But each of us in that team has something that they're really good at. We've got Rebecca, who is amazing at organizing events, so she runs the events team. So each of us have this skill set. And what I'm kind of learning now, I guess as I'm developing through that journey, is that you don't always have to be the big boss, and you don't have to 100% own something. Join in with other people. Someone out there will have that skill set that you don't have. So why waste your time and expertise trying to become the accountant or, the graphics guy? I bet there's somebody out there that already is so good at that.
Yeah.
But maybe they don't have the skill set that you have. Absolutely.
I mean, it's so funny that you're saying that, because that is something that I think a lot of entrepreneurs struggle with, right? It's their idea, their baby, and they want to do all the things because nobody can do it like they do. So when did you come to that aha moment or realization that perhaps I don't need to do all the things?
I think it's probably part of maturing as a business owner. Everybody, the first time you start a business, doesn't matter if you're 16 or 60, you always think I can do it all and I have to do it all and I can't ask for help. And I think the more you do it, the more you actually start to work out, really you've got to work out how valuable is your own time. And so for me, pretty much every job I've always done, it's kind of like a billable hours. I know I get paid per hour. I've never had an office job. I've never worked a salary. So for me, every hour has to count.
Right.
Which is a double-edged sword, because when you want to relax, you're like, how much does this cost?
Right.
But from a business...
Do you really think that?
Oh, yeah. And it's a bad habit. I'm trying to get better at it, but... So it's adjusting
like playing
that.
with the kids. How much am I losing?
Yeah, exactly. That's 40 minutes. How many emails? Which now I learn, that's not a healthy thing.
Yes.
But then you get to the point of you think, well, but if I had someone else helping me in my business, if I had someone doing the website for me. Who is still on
task, I'd still be...
And actually, the speed of your business, it works so much quicker. Because, say, with Moongate, because there's 6 of us, we work 6 times faster, because each 6 of us will have our meeting. We'll decide, okay, what are you going to do? What are you going to do? And then you go out. And the speed that you're able to do something is so much quicker than if it was just you.
Right.
And with any business, the more insight you have from other people is great. So I guess a key thing for me. So I've been on the island for 12 years. I started Atlantic Podiatry 2 years ago. So I worked for somebody else for 10 years. I would say it came to an end a little abruptly. I was given an ultimatum that was not a good option. I'd become quite comfortable in that, and I was like, fine, I'm going to work here, and then I'll do my other projects. And then, I had that discussion with my wife, and okay, so what are we going to do? We've got a baby on the way. We've got all these other projects. She said, well, you always talked about starting your own business for podiatry, so why don't you look at doing that? So that was, 3 months of just putting my head down and grinding away. And I think being any kind of a small business owner or a business owner, it can be quite lonely and there's a lot of pressure on you as an individual. So I think having someone to talk to, whether it's a friend, a partner, or someone else in the business is great. And that's where BDC is great, because there's always an option you can reach out to somebody. So for me, I had that kind of pressure to get things open, which we did. And I called in every friend.
I know that's right.
I could reach out. Huge shout out to Hannah Jones, who she runs Island Nutrition.
Okay.
We share the office space. I reached out to her and I was like, I need something. What can you do? She made me a little office, and we got ourselves up and running from there. So again, with Bermuda, we're all such a small community. I guarantee there's someone out there that can probably help you out.
And I wanted to ask you about that, because you're talking about partnerships and working with people to lessen your load and to ensure that you have a kind of diverse ideas about how to run and operate the business. But how do you identify these people? Because that can be the challenge. It can be a good thing and a bad thing. So, and you have multiple businesses and multiple partners. So how do you do that?
I try to do it as naturally as possible. So try and socialize, meet people. So for me, every time, so the guys that I work with for Moongate, I actually met Rob, because he was a bartender with us at Moongate, Blind Pig.
At Blind Pig, okay.
So I got to know him anyway. We got, talking about like, what did he want to do? And he really wanted to open this brewery. And we kind of decided, okay, well, so maybe that's something we can work together with. So have those connections. So, I know BDC is looking at doing like a couple of different social events. Something like that is great. Because maybe you already know someone, or maybe it's a friend of a friend, or maybe you're just going to have that conversation with someone and they're like, hey, you can work together. The temptation for anyone that wants to start a business is you want to keep it to yourself because you don't want someone else to steal it.
Yeah.
You've got to accept that. So some businesses, so say Atlantic Podiatry is not a revolutionary thing.
Right, exactly.
There's other businesses, there's businesses that have been on the island for years and years. What you've got to work out is, what is your business going to do that's different? Is there a gap in the market? Are you just going to do what everyone else does but better? And so my approach for any of these businesses has been to identify what's already around.
Right.
If it's something that you can go and visit and check out, go and do that. Be a customer. The best thing you can do for your own business is to be your customer.
Right.
So for, say, myself for Atlantic Podiatry, I know how other medical practices were set up. I knew, there was frustrations for people on, I can't book online.
Correct.
So for me, that was the first thing I did. I set up the website and we have online booking 24/7. Other people, it's, my life gets busy. I need someone to help remind me. So we have reminder calls. So you get a text message 2 hours before and an email 24 hours before. You can book your, appointments. You can shuffle them around. We don't charge fees for that. And then from a visual point of view, and I think a lot of us forget, we get so involved in the actual setting up the business. Take yourself out and then go back into your business again as the customer and walk around your premises if you have a physical location and look at the building. Is it welcoming? Is it, so for myself, we newly renovated the building, so it's clean white walls. It's having, a fresh and sort of inviting atmosphere. It's making sure that if you were the customer, you feel at home.
Right.
And for myself, I sell a couple of products, and it's always things that I think are useful. But again, how are you displaying them? How are you marketing them? Is it something that you believe in as well? Because it's hard to sell something if you don't believe in it.
Correct.
So it's going to be a lot of trial and error.
So let me ask you this in terms of, like, let's say the products. You said it's things that you think would be good to sell. Do you involve your customers in that? Like, how do you get feedback? How do you gauge whether or not what you've selected works for them? What is your process for that?
Yeah. So, for Atlantic Podiatry, it's going to be, is there certain tools or equipment or a product that I know works well from experience? I can recommend that. And, you're always having that discussion with people. You have to be open for criticism and ways to grow in any business. So you may have a patient that come in and that says, actually, do you know what, that moisturizer, say, it wasn't great. It was a little oily. I didn't like it. Okay, well, great. So maybe, is there one that you like that works better? And then we can, looking at adapting with that. So yeah, you try not to take things too personally.
Right.
And criticism is natural. Not everyone is going to love what you do. Try and find, if you do get some negative feedback, is there room to grow? Is there a mistake that you made? Or is it something that maybe wasn't explained to, your client, your customer, your patient? And you just accept that we all make mistakes.
We all make mistakes. Yeah. And I think the key that you said is being open to receive that, right? So I want to go back a little bit because we just jumped right in. But so you've been here for 12 years. Yeah. You were originally from the UK.
Yeah.
So talk to me a little bit about your experience in the UK and how it may be similar or different, and how it has how you've incorporated your experience into your businesses that you formed.
Yeah. So grew up in the UK. I met my wife to be, Sophie. So she's Bermudian, but she was living over in the UK at the time. But I didn't come from a background where I had a lot of money. And so, I did paper rounds when I was 12. There was always kind of a side hustle doing something. And then I actually met her. I was working at a fast food stand at a football stadium. That was another one of my little side projects. But for me, it's always been kind of something to kind of push me along. I knew I wanted to go into some kind of a healthcare, but I didn't know what. I actually started another degree. Got a year or two into it and just decided, this isn't for me. I'm not enjoying it. And that was a hard decision to make.
Especially in the UK, because you literally have to start all over. It's not like you're transferring anything.
Yeah. And so I tell a lot of people that if you want to go to university, it's great. It's not for everyone. But find out where that degree is going to take you. Are there jobs at the end of it? Because not all degrees are going to guarantee you a job. And if you're going to spend 4 or 5 years of your life studying something, you really want a job from it. So for me, I had that moment. I'm sitting there in classes and I'm like, I don't enjoy this. I've looked into it. I'm not going to get a job in this. I had so many friends that had done this degree and then they're stacking shelves or they're doing something else. I'm like, I can't do that.
Yeah.
So I kind of, I put a pause on that. I took a year out and I worked full time. I worked in coffee shops and bars. I just worked in hospitality. I worked 90, 100 hours a week. And, I enjoyed it. And that's where I kind of picked up my passion for hospitality.
Gotcha.
But at the same time, I realized I'm like, this is a lot of work. And I'm not really making any money. I'm not getting that enjoyment from life. So that then gave me the drive to go back. So I looked into careers. I knew I wanted to do healthcare. I knew I was quite a hands-on kind of learner. And that's where kind of podiatry came up.
Okay.
Really good opportunities for traveling and for working, great employment options. So I then came back into that course. A little bit older than some of the other people, but I kind of hit the ground running.
Yeah, because you already knew. You knew what, and you were focused. I had my goal.
Everyone else was, they're kind of messing around. I was like, this is what I'm doing. I came in. I'm one of those people, I always like to have a goal or a plan. And it doesn't have to be too rigid, but know where you want to be. So by the second year, I was already reaching out to potential employers. Like, can I show up to your job? Can I do some work shadowing? What can I do to help out? And so I would look at those practices over in the UK. Like I was studying up in Scotland. I'd go into the private practices and the hospital settings and like, okay, so what do you guys do? Like, is there a specialism? Like, is there any handouts, any leaflets? I collect everything.
Yeah.
I had like a little pack of like, oh, that looks cool. Let me take a photograph of that. So then when it came to the point of graduating and be ready to finish, I had some jobs lined up. I was ready to go. And then I started, my wife and I having that discussion. Okay, well, we have the opportunity to move back to Bermuda. Maybe we need to look at doing that. Scotland's population from kind of a health point of view is actually very similar to Bermuda. We have quite high rates of diabetes in Bermuda and in Scotland. And generally, we have a lot of similar conditions. So it worked very well for transitioning back over to Bermuda because I already had an idea of the population and some of the issues that we had. The benefit of being off island was that I got to see how things are done slightly different. Bermuda can be a bit of a small bubble.
Yes.
So I always tell people, if you can, even if it's just traveling, get off the island, see what other people are doing. If you have an idea for a business, go somewhere else and see, does that business work outside in different countries? Does it exist in Bermuda? If it doesn't exist in Bermuda, great. If it does, how can you do it better?
Yes.
Right? And I think a lot of people get defeated because they're like, they may even have an idea and then suddenly next week someone else opens that same thing. but it's not your idea.
Thank you. Can you say that again,
exactly.
please?
It doesn't
For those in the back.
Yeah, it doesn't. None of us are going to have 100% unique idea. Or some of us, but it's a rare thing. But
very rare.
Know what you want to do and just be true to that vision.
You know what I say to people? I say, no idea is unique in most cases, but you are unique.
Exactly.
How you approach it and how you deliver on whatever the thing is going to be different than anyone else. Yeah. And focus on that.
Yeah. And, so say with Blind Pig, we were one of the first kind of mobile cocktail companies because that was a concept people hadn't really thought of before. A couple of sort of the businesses that Gosling's and Burroughs were doing something, but it wasn't quite what people wanted. They wanted customized cocktails, everything like that. So we did that. And there have been some businesses since that are also doing.
Right.
But I kind of like that idea because we got to the point where we were so busy that we then created other business opportunities. And those businesses that opened that are also cocktail catering, they're not the same as Blind Pig. Right. They have their own spin, which is great because now you have this, you kind of build a variety. And it's great. People like that. And then people then, if they can't see Blind Pig, they'll see somebody else. But if they can't see them, maybe they come to Blind Pig. So it all kind of...
It can work.
It builds, yeah.
I think because Bermuda is so small, and I say this, we have these kind of forced monopolies, right? Because you have someone enter into a space and either the barrier entry is too high for others or whatever the case may be, and it's like, well, I have one or two, that's all I need. Yeah. But I refute that. I think that there is opportunity. When you are doing something like you said, you worked for a different podiatrist, you saw some of the things that could be done better, and now you had an opportunity to do your own or start your own, and you're doing that. Yeah. So I like how you are framing how you look at entrepreneurship. Because I think people need to hear that and understand that. It's okay that you are one of 2, 3, 4, or 5, or 6, but you're only one of you, right?
Exactly.
And so how you do the thing is really what you should be focused on.
And how do you market it? How do you tell people about it? So again, I'm the only practice that we go on the radio once a month and we do kind of educational stuff. We do some social media things. We do a lot of stuff that maybe the other practices are doing, but they don't tell people about. And I think that's what a lot of businesses do. Tell everybody everything you do. Put it out there so that they know what you're doing. Don't sit on it. And it's probably a great idea, but if no one knows about it, how are they going to use you?
Yeah, that's very true. But like I said, back in the day, well, it was only one of 2, so you got to go to... So I do think that the fact that you came from the UK where it's a larger population, and that's just natural business, you have to do that, or else you're not going to capture any market share. So some of the things that you've already started talking about that makes Atlantic Podiatry stand out are the fact that you're doing these kind of social medias, you're telling people about what it is you do. Now, there is... a specific initiative, Care in the Community, that you launched. Talk a little bit about that and why you think it was important to do.
Yeah, so Care in the Community initiative we launched because we saw that a lot of patients are struggling to come into the office. Our office is wheelchair accessible. We have nearby parking. We've made it as accessible as possible, but some of us have issues, getting transported around. You have a loved one, maybe they're bedbound. And so we decided, well, if you can't come to the clinic, now the clinic needs to come to you.
Okay.
What we don't want is people to get into a situation where they have an issue with their foot and then they can't get it fixed and it becomes something worse. For me, podiatry, we're all about prevention. I need to prevent you getting sick, you losing the limb, and we need to just generally bring that cost of healthcare down. So for us, the Care in the Community initiative gives us the opportunity. We can go out to you. We also then, sort of building on that, we reached out to the care homes and said, well, look, can we work with you? So maybe we can look at, if we see multiple patients in one go, we could look at reducing the price because we're seeing more people. We're not driving around as much.
Right.
It saves you money. It saves us money and time, and it takes that strain off of the care homes and off the nursing staff. So it's all about, and again, find the niche. Find maybe other people are doing it, but maybe they're not pushing it. Maybe they're not discussing it. Podiatry, most healthcare, we don't talk about it. We know it's there.
Yeah.
But for a lot of people, if you have major medical, podiatry is one of the many things that you're covered for. So why not use it?
I know.
Just, you're paying for it, use it. And that's anything out there.
I think we only think about if there's a problem.
Exactly, yeah.
Not, like you said, making sure that the problem doesn't happen. If you're doing maintenance and going regularly and getting checked and making sure everything's okay, hopefully you won't need to use us when things are going wrong. But I don't think we think about it that way as users.
And and that's definitely sort of a mindset. You hear now a lot of the health insurance companies talking about preventative medicine. So that's their big thing, have your annual check at the GP. If you're a male or a female over 45, there's certain other tests you need to be getting. And we're all worried that we might get bad news, but you actually want the good news. I go every year and everything's fine. If they do find something, they find it early. So
let's talk about what we should be looking for, why we should be going to the podiatrist more frequently. What kinds of things should we be going for?
I mean, you've got general aches and pains. So if you're waking up, say, every morning and you've got pain in the heel, pain in the leg, so that's an indicator of something. And most likely it's probably a tendon or a soft tissue issue. So why limp around and be in pain and worrying about it? For some people, we get things like discolored toenails. So Dr. Google, people will go on and they're like, if my toenail's black, Bob Marley died of, nail cancer.
Yeah.
So that's all it is. Nail melanoma was a dark discoloration on his toenail. Didn't pay any attention, it became something more serious. The problem is that now scares people, and they're like, oh, now I'm worried it might be cancer, so I don't want to look at it. Well, come in, we're going to check it out. I would say 99% of the time,
it's not.
It's a bruise, it's fungus. It's something that we can treat. Even if it was, we would then refer you on, we would catch it. It wouldn't be an issue. We could get it fixed. For a lot of people, they will just look at their policy and they say, do you know what, my insurance covers 12 visits a year to a podiatrist. So maybe I should come in, that little piece of hard skin, that, bit of pain I was getting, or maybe when I'm exercising, I'm getting like a lot of arch pain. That's what a podiatrist does.
Okay.
We also do the kind of the more serious side. We do things like diabetic wounds and prevention. So if you're diabetic, you should be getting an annual check.
Right.
Just to make sure your pulses are good. Make sure you're not having any issues. For some people, it's peace of mind,
So let me ask you this, because, women, we like to wear all these cute shoes. They're not always practical, though. You end up worse off than you were before you put them on. So bunions.
Yeah.
Is that something that is treatable, or once you have one, that's it? You just gotta...
So generally speaking, if the bone, the shape of the foot has changed, really the only fix is surgery. Now, the surgery is actually a relatively minor procedure, and it's not the big painful procedure that it used to be.
Okay.
That would be someone like an orthopedic surgeon would carry that out. But as a podiatrist, we can assess it, we can do the referral, we can kind of get that pathway started for you. There is, we can discuss footwear options, we can discuss like insoles. So there are some options, but as always, if you've left it to the point where it's got really bad, then sometimes the fix is just that little bit more.
But that's something options. You can go and get checked.
Exactly.
Okay.
Yeah.
All right. So we're talking about prevention, people.
Yeah, exactly.
Okay, so I have here that you offer scholarships.
Yes, that's right.
Yeah, let's talk about that.
So April, May is kind of around the time. It was all a bit of a blur at the time, but that was when the clinic opened in 2023.
Okay.
So to celebrate our 1-year anniversary last year, we launched a $50,000 scholarship. The idea is that I will pay for a Bermudian to go to school in the UK. Ideally in the UK and ideally in Scotland, because they have a similar population to us. I'll pay for the cost of your degree. I will get you to school, we'll get you graduated, and then when you're ready to come home, hopefully relatively soon, I'll then offer you a job at the practice as well. So I will give you all of the opportunities that I didn't have and that stress.
Right.
What you don't want to be doing is going to school wondering, like, where am I going to get the money from? Am I going to have a job at the end? And for me, once we entered into our second year at the business, I hired Megan, a new podiatrist, and now there's 2 of us. I'd like to see that, hopefully there's room for us to add more podiatrists.
Right.
So for me, it's also investing in some growth for the business. I want a new podiatrist to come work with me. It's in my interest to have a Bermudian because you're going to be more invested in what you do.
Correct.
I'm here to stay, so this is why I'm doing it. And I want the next generation of podiatrists to have that same kind of want to stay and help.
Yes, I love that. So you got tons of applications, right?
No, not a great deal. So to mark year 2, we've then doubled it. So we're now offering 2 scholarships. So that's the opportunity for 2 Bermudians. So that now takes it up to $100,000. We've had some kind of interest and people wanting to get a bit of information, but it hasn't gone all the way through to an actual full application. So if you are anyone that is out there.
Please, hello, did you just hear what he said? Yeah, he's gonna pay for you to go to school, get your podiatry degree, and then come back and get a job and work.
Then you get to go on the radio and we get to come in and do these interviews. It's all good. Yeah.
It's all good. But like in my mind, I'm thinking, okay, workforce development, surely there has to be, I guess people don't think about podiatry, right?
Healthcare in general, you'll find, and it was the same when I came up in school, healthcare isn't really pushed on people. You're told, you can either be a doctor, a lawyer, or an accountant.
Yes, correct.
But if you don't fit that box, I wasn't academic enough to be any of those. I wasn't a numbers person. I was quite a hands-on visual learner. So I needed something that was going to kind of tick all of those boxes. And I wanted to help people, but I didn't know how.
Right.
And there are so many options and there's so many things out there that sometimes you just need some guidance. And, for people out there that may be interested or they're not sure, reach out to me. I'm always happy to chat. It may be that podiatry isn't for you. Maybe it's physiotherapy, maybe it's something else, but I can give you my input and I can hopefully steer you in the right direction.
Surely we can find 2 young Bermudians that want to get a degree in podiatry that is completely sponsored. Yeah. Surely.
Well, because, for me as well, Megan, who's working on our team, she's our youngest podiatrist on island. And so the rest of us are getting a little bit older. And so we need to start thinking about, and that's the same for most of our healthcare providers, we're all getting older.
Yeah.
And where's the generation behind us to come and fill the gap? And there's not a great deal of it.
Right.
So we need to start finding that. And I think for Bermuda's healthcare, trying to reduce our costs, a lot of our issues is that some of our healthcare providers, they're on work permits. They're here to do the job, and then they go. But there's not that long-term investment in trying to help Bermuda's population. So all of our local healthcare providers are working really hard to do that, but now we need that extra support. We need the younger people behind us.
Yeah, I love it. That is awesome, Matt. So if people are listening and they're interested, how should they get more information?
So you can either go on the website, atlantic-podiatry.com. You can give us a call, 533-2508, and we can push you through. Or you can go onto the Bermuda Scholarships website and just type in Atlantic Podiatry. On the scholarships website, I've put in all of the information about the degree, about a couple of the different universities, entry requirements, all of that. We can at least have a look at that. Do you fit the criteria? And if you don't, reach out. And there's always things we can do to work around. And like I said, maybe it's not podiatry for you, but maybe there's another healthcare profession that you never heard of, you never thought about, and that could be your life.
Yeah, that is awesome. I think that's great. Well done, you. So we're going to switch gears and talk about Blind Pig, and just talk to me a little bit about that. Now, you said that when you were in the UK, you were in hospitality. Yeah. So you have a great personality, very personable, so I can see that for you. So talk to me a little bit about Blind Pig and how that came to be.
So I was quite an introverted, shy person as a child in school. Okay. I had that opportunity, and what I loved about get out of your town. Like I grew up in a little small town. Everyone knew me as kind of the little quiet, shy guy. I left my town. I moved to Scotland. New place. No one knew me. I reinvented myself. And I'm like, okay, so what did I want? I wanted to be a bit more outgoing. I wanted to be more friendly. I wanted to talk to people. Hospitality is one of those careers that I tell people, if you can, work in it. Even if it's not your long term, but the life skills you will learn from that. You're going to learn about how to work with different people, how to deal with stressful situations, how to handle negative feedback. It's a character building. And I just love that. I'm a very hands-on person. So initially I started making coffee, so I was a barista. I loved the idea of creating something and someone enjoying it. I then transitioned into bartending and I did cocktails. I've always my thing is always trying to find how can I do things better, how can I standardize it, how can I improve. So then I kind of moved into cocktail training, so I would then train the staff. When I moved to Bermuda, it was, to be a sensible podiatrist, and then I kind of
that itch was there. You were like, what else can I do?
I'd go into a couple bars and I'm like, all right, well, see, I don't really you guys could be doing this better. Right. So I started reaching out to some bars. I started working in them. I started writing kind of training programs. And then I got to the point I'm like, but I'm training other people and it's not benefiting me. Morally, I'm enjoying it. But from a business point of view, I'm giving away my trade secrets. Yes. So I'd always wanted to open a bricks and mortar. I wanted a physical location. I realized I don't have the money. I don't have that skill set. And I kind of got reaching out to other people. And Summers was a fantastic bartender. He'd served me a couple of times and I'd run into him. And I knew there's this guy. And I'm like, if the two of us could do something together, it would be great. And so we had this talk and we're like, okay, well, we can't if only there was a way for us to bring the bar to people. And then it was kind of that moment where like, well, why don't we do that?
Yeah.
Why don't we build a mobile bar, and why don't we bring it to people? And why don't we give each person, when they book Blind Pig, they get a customized experience? What cocktails do you like? What names do you want to call them? You can do whatever you want. And the idea with Blind Pig is we kind of had this kind of speakeasy vibe, because the idea is that we would show up in your backyard in your house, and we would create this bar, and then overnight it disappears.
Right.
And that's it. You wake up the next day, maybe with a sore head, but we're gone. And people,
there's no evidence
of it.
Proof.
And it was great. It gives us all these opportunities. We got to meet all these different people, and and it's a full on. It's a lot. It's emails 24 hours a day and hustling. But for both of us, it was this passion. Like, we love doing it, and yes, it's late nights and it's early mornings. But if you're doing something you love, you accept it.
Yeah, you enjoy it.
And, big shout out to my wife, who's kind of my work widow, because, if I'm working all day and then that's it, I'm disappearing out at night. But you need to have that support network as well. And so have people there that, when you're a little down, they pick you up. But also when you just need that, I got you. You're like, you got to do this, then let me run everything else. And she was great at kind of making sure that I'll get the rest of life going.
Yeah.
You just do what you enjoy.
All right, you picked a good one.
Oh, yeah. Yeah.
So I mean, 30 minutes has gone by quick. We could probably spend a whole hour, because you have all of these different things, which is really exciting to hear how you're navigating the space, right? Because I'm thinking, okay, doctor, podiatry is this, what is it, left brain, right brain, one of the things, I don't even know if that's a true thing, but it seems like you're really getting a chance to utilize your creativity, and you get a chance to ensure that people are maintaining their health. So it's like a wonderful match made in heaven, how you're able to do all of this with a child and a wife and a baby on the way. I'm still quite unsure. We'll probably have to have further conversations about that. But as we wrap up, what advice or guidance would you give to someone who's a serial entrepreneur such as yourself, and how to manage it all?
Yeah. So don't be afraid of failure. We all fail. It's how you bounce back from that failure. And so, I've tried many things. I've proposed many ideas, and I've tried to start many businesses, and some of them didn't work. You've got to, and it's a hard lesson, but learn when to cut your loss. Or learn to be like, okay, so do you know what? Maybe this isn't going to make me happy. And the temptation for a lot of us out there is you do one thing, and then you want to do another, and you want to do another. You've got to learn to kind of be happy with what you have, and make sure each thing you're offering is the very best. Go back to it, review it, revise it, be open to changes and be open to adapting. And I think for me, my biggest lesson is don't be the sole owner. Find your team, find your network. And all right, maybe you're splitting the profits, but you're splitting the workload, you're splitting the stress. Everything will work better, and be open to change and just adapt.
And the chances of the profits increasing go up. So the profits that you're splitting are more than if you were doing it by yourself.
And each person you reach out to and you talk to opens another door. And in Bermuda, we all have these networks, right?
That's very true.
Before you know it, you may find someone else or something else you weren't even thinking about, and that's now your thing. And that's, and for me, I'm now finding these other little networks from so now I have these skill sets. I know how to set up a business. I know how to streamline it. How can I help other people? So for me now, I'm trying to focus on there is other little businesses out there that maybe if I just help them, we get them 5 years further along than they could be.
So is
now
that's what you're doing now?
That's what I'm trying to do. Yeah, there's been a couple people that I can now say, hey, I like what you're doing.
Yeah.
It's a great option, but how about we do this, this, and this? And now this is going to put you that little bit further. Because I know how stressful it is when you start a business. You have no money, you have no time. So if you have that skill set, why not help somebody else?
Okay, so basically they can reach out to you and then... Is that what you're saying? He's like, no, don't do that. No, seriously though, but I really do appreciate you coming on, sharing a little bit of your story and how you're thinking, which I love. And I would, if you allow me, if you're willing to assist some of the businesses that we work with, I would love to see you come in and chat with them, because I think a lot of what you said would resonate with them, because they are sometimes stuck and don't really know how to get to the next level.
Yeah, definitely. And like you said, it's all that part of growing as an individual, but as a business owner, you need to learn know what you don't know.
Yeah.
But know what you need to know.
That's right.
So, yeah.
I love that. Thank you, Matt. Thank
pleasure.
you for minding your business with us. And remember, if you don't mind your business, who will?
Ain't that the truth?
Thanks for tuning in to Mind Your Business with me, your host, Jamillah Lodge. Tune in next week, Thursday at 4 p.m. because if you don't mind your business, who will? Mind Your Business is brought to you by BEDC. Bermuda Business starts here.